Hello, everyone, and welcome to Heads Up, the official weekly podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel, migraine strategist, chronic daily migraine survivor, and founder of the Facebook Migraine Nation. I'm here each week bringing you up-to-date information and tidbits with Dr. Vincent Martin, MD, director of the Head and Facial Pain Clinic at University of Cincinnati and the president of the National Headache Foundation. Hello, Dr. Martin.
It's a pleasure to be here.
Yes, we are both very excited to be here. Our topic today is what is a migraine, and could I be experiencing more than one type of headache? So without any delay, why don't we just describe what a migraine is?
Well, a migraine is typically a headache that has moderate to severe pain intensity. It's usually on one side of the head in about maybe 6 out of 10 times. It tends to be throbbing, probably about 6 to 7 out of 10 times. And then besides that, patients often have nausea, vomiting, or sensitivity to light or noise. And oftentimes I call migraine what I tell my patients is that migraine's the triple whammy. And they say, well, what is that? And the triple whammy is basically, it's not bad enough that you have really severe pain and so forth, but you also have sensitivity to light and noise. You have to withdraw into a dark room. And then if that yet isn't bad enough, you also have nausea and feel like you want to not eat or drink. So It's almost like you're a werewolf. You have to withdraw into a dark room in addition to suffering this severe and incapacitating pain.
I've heard some people say werewolf, and I hear some people say they feel like a vampire because they have to sit in the dark all the time. Can you tell us what are some easy ways to diagnose migraine?
Well, typically, if you have a long-standing history of migraine and the headaches are disabling, so you have this history of having to lay in a dark room or miss work or miss social activities, and assuming you don't have any other causes for headache, which if you've had it for a long period of time, it's unlikely you've got like a brain tumor or something like that. Right. So recurrent disabling headaches is one kind of simplified way to make the diagnosis. But the other way also is if you have headaches with nausea. In fact, we did a study in over 1,500 patients, probably about 15 years ago, and we found that if patients had headaches and nausea, there was an 80% chance or greater that they had migraine.
All right. Well, that's interesting. So I guess my next question would be, there's a couple other kinds of headaches that we can get that some people wonder if they're migraines or how they know which one they are. And the first one I'm curious about is tension headaches. Can you describe those a little bit and how they might be different from a migraine?
Well, tension type headaches are almost the exact opposite of migraine. So migraine tends to be moderate to severe, and tension type headaches tend to be mild to moderate in severity. So they're much milder headaches. Okay. In addition, they tend to be generally on both sides of the head, whereas migraines most of the time are one-sided. And they tend to lack the other symptoms of migraine, like we talked about that triple whammy. So the two components, the sensitivity to light, noise, and nausea, generally are absent with tension type headache, although by strict criteria, you can still have either sensitivity to light or noise and have those other criteria that I mentioned, and you can still have tension type headache.
Okay. Can you tell us, can tension headaches cause migraine, and can migraine cause tension headaches? Is there a relationship? Do they make each other worse? Or are they totally separate?
Well, it depends. If both migraine and tension type headaches exist in the same patient together, many headache physicians think they're just kind of one spectrum of the same headache disorder, and the tension type headaches are kind of mild migraines. And then when they evolve into a more severe type of headache, they resemble a migraine. Now, when tension type headaches occur in the absence of migraine, then they wouldn't obviously necessarily evolve into migraine. They just kind of stay at a very low level. Okay. So the bottom line is they can sometimes evolve into a migraine, but if you don't have migraine disorder, then they probably won't. They'll stay at that low level.
Right. And the other type of headache that I was curious about that I sort of wanted to compare to migraine for everyone was a cluster headache. Can you give a little bit of a description of that and tell us how it's different from the other two?
Cluster headaches are strictly one-sided headaches for the most part. What that means is that oftentimes patients will have these what they call clusters. They might have like 2 or 3 months worth of headaches. and then they'll be completely headache free for an entire year. And then the headaches will come back, or it might even be 2 or 3 years between these clusters of headaches. That's why they're called cluster headaches. And the headaches are usually in a characteristic location. So they usually happen either around the eye, in the forehead, or in the temple. So they're kind of in this region. And they, for the most part, are extremely severe headaches. In fact, they're more severe than what a typical migraine patient would have.
Right.
And they last a much shorter duration. So migraines typically last 4 to 72 hours, and these last 15 minutes to 3 hours. And then they have characteristic symptoms along with them. Just like migraine has a sensitivity to light, noise, and nausea, these will have tearing of the eye, running of the nose. Sometimes the eyelid can droop. Sometimes the pupil can constrict on one side. And usually cluster patients tend to pace. So they usually are pacing back and forth because the pain is so severe. Whereas migraine patients find relief by laying in a dark room. They tend not to pace. So really it's a different disorder. In addition, cluster headaches tend to occur more commonly in men than women, which almost every other pain syndrome, including migraine, is more common in women than men, because the cyclic fluctuations in hormones that occur as part of the menstrual cycle probably bring out a predisposition to develop migraine. And when migraines do occur in women, they often tend to be more disabling and more severe.
Right. I was going to say that whenever I meet someone that is experiencing classic cluster headaches, what always surprises me that's different from the migraines I experience is I'll know for quite a while that I'm getting a migraine. And I've watched people just all of a sudden, the cluster headache comes on so fast and it hits that 10 out of 10 pain level really quickly. And then it's gone so much quicker than my migraines. So I find them very interesting. But my next question is, so I know that with my history, I had a migraine essentially every day from the age of 4 to age of 30. So I have a fairly significant migraine background. But I will notice that sometimes if I just have, one of my normal migraines, that all of a sudden my eye might some days turn red, or it might water, or my nose will get stuffy. And this is just one of the 10 to 20 or 10 to 15 types of headaches I get. So I'm curious, does that mean I'm getting, cluster headache on top of my migraine, or no?
Not necessarily. The symptoms you described are called autonomic symptoms. So they're either manifestations of the sympathetic nervous system being underactive, which is when you get the droopy eye or constricted pupil, or signs of the opposite part of the autonomic nervous system called the parasympathetic, and that causes the tearing of the eye and running of the nose. And those autonomic symptoms can occur with a variety of different headache disorder. They're probably classically described with cluster, and there's also some other disorders that have them as well. But even migraine can have them as well. And the main differentiating feature would be the duration of the headache attacks. Right. So with cluster, you have these defined attacks that last for a short duration, 15 minutes to 3 hours. Then they're pain-free between attacks, and then the headache may come back. And oftentimes the headache may come back at at the same time every day. It's almost like an alarm clock. The patient might be woken up at 3 o'clock in the morning. With migraine, the attacks last 4 to 72 hours. Mm-hmm. And then what happens is there's no, break in the pain, usually, unless you have a treatment that just totally, resolves the headache attack. Usually there's still some lingering pain that persists for 4 to 72 hours. So it's primarily the duration of the attack that would differentiate migraine from cluster, but you can have autonomic symptoms in both.
Right. Okay. That's awesome. Thank you. Everyone, talks about that. So I'm always very curious. So my next question is, we discussed that aura is one of the ways that we look and see that someone's having a migraine. And we talk about auras, different auras, when they come, when they go away. Do I have to get an aura to have a migraine? Can you delve a little more into what an aura is?
A lot of people have misconceptions about what an aura is. For example, many people think that if they just have some premonition that a headache is going to come on, that's an aura. But the reality is, an aura is a neurologic event. And there's many different types of aura, but there are 4 that are more common. The most common aura is a visual aura. So what happens is people will get flashing lights or zigzaggy lines that usually start real small and then gradually enlarge in their vision to the point where if they hold up their finger, say in the, towards the outside of their eye, that you can't even see your finger.
Mm-hmm.
And the aura lasts a characteristic duration. So it generally lasts 5 to 60 minutes, although I will tell you that there can be exceptions to the rule where it may last a little bit shorter or a little bit longer. And it generally precedes the headache phase of the migraine by about within an hour. The headache comes on after the aura begins. So that's one kind of an aura called the visual aura.
Right.
Then there's something called a sensory aura, where people will get, say, some tingling or numbness of their face, and then it might march down to the arm, and then it might march down to the hand.
Mm-hmm.
And then finally, there's something called a motor aura, what they call hemiplegic migraine, where people can get, weakness on one side of their body. And for all intents and purposes, some people may think they're having a stroke.
Right.
But the way you differentiate a hemiplegic migraine from, say, a stroke is that all the weakness, say, in the face, the arm, and the leg occur all at once with a stroke, whereas with a hemiplegic migraine, there's a march of symptoms. So it might start out in the face, and they might get some weakness in the face, and then it might go to the arm, and then it might go to the leg. So there's a march of symptoms with that. And then finally, there's something called a speech aura, where people can have a garbled speech. In fact, there was one TV reporter that was reporting on, it was either the Emmys or the Academy Awards.
Yeah, I can't remember either, but I know what you're talking about. Yeah.
She was talking, and all of a sudden, she just starts garble words. And initially, they thought that she was having a stroke. I mean, you can imagine how scared somebody would be if they hadn't had that before. And sure enough, that was just a speech aura.
Right. Speaking of people getting scared, I have definitely met people who will have a lot of fear associated with if they always have a right-sided migraine and suddenly one day it's on the left. Is this a common phenomenon, or is this a sign of something really serious?
Well, no. I mean, I think there are some people that will have a migraine just only on one side, although it's rare. When you really question people, they'll say, well, yes, my headaches are normally on the right, but every so often I'll have one on my left.
Right.
If a headache were to occur just on one side, and if it would be, say, a persistent and continuous headaches, then you would think about other headache disorders. And there's another disorder called hemicrania continua, which is a continuous headache on one side of the headache associated with those autonomic symptoms we talked about before, where you get tearing of the eye and running of the nose. What's interesting about that headache disorder is it's exquisitely sensitive to an anti-inflammatory called indomethacin. And if people respond to that, then sometimes the headaches will completely go away. In fact, some people think that response to indomethacin is necessary for a diagnosis of this disorder. And some people have been thought to have migraine, say, for many years, or even chronic migraine, where they're having headaches all the time, and they really had hemicrania continua. So that's one diagnosis that can sometimes mimic chronic migraine, which we didn't really talk about, but chronic migraine is a more severe form of migraine where you get 15 or more days per month with migraine.
Right.
8 of which those days or more have migraine characteristics.
Okay. And then, so chronic is 15 or more, and then it's called episodic if it's less than that. Is that true?
There's no formal criteria for episodic, but it falls into the migraine either with or without aura category.
Okay.
If it's less than 15, and then it's chronic if it's more than 15.
Okay. One last question I had was, I often hear from people that they feel that they have sinus headaches, and what they're feeling they believe is a sinus headache, but it's been there their whole life. Like, it's very chronic and it doesn't go away. And I'm curious if some of that could be migraine or one of the other headaches that we've talked about.
Well, sinus headache is a common disorder in layman's terms, but in the official diagnostic criteria for headache, there's really only one sinus condition for sure that's linked with headaches, and that's when you have a sinus infection.
Right.
So when you have a sinus infection, usually you're having a fever and you're having pain over a sinus, say your cheekbone, which is your maxillary sinus, or your forehead, which is your frontal sinus. And then you have discolored drainage on that side as well. So it's a triad of of pain over the sinus, a fever, and also a discolored nasal drainage, particularly on that side. Sometimes it's even bloody.
Okay.
And everyone would agree that someone who has one of these acute sinus infections can get pain over the involved sinus. So it might be over the cheekbone, or might be between the eyes, or it might be in the forehead.
Mm-hmm.
Now, that's a sinus infection. Now, what most people call sinus headache is where you have a headache and you have a lot of other nasal symptoms usually.
Right.
So patients will say, well, I've got a runny nose, or I've got a stuffed up nose, or I've got postnasal drip, or my hay fever symptoms occur along with my migraines.
Right.
And that's really a different situation. Oftentimes in that situation, people either have something called allergic rhinitis, which is where you have an allergy to some allergen like cat dander, or to tree pollen or grass pollen. And usually it occurs, if it's a pollen, then it usually occurs during a given season. And then upon exposure to that allergen, you'll get nasal congestion, or you'll get runny nose. And these hay fever symptoms often accompany migraine.
Right.
And in one study where patients thought they had sinus headaches, and so they had these other symptoms along with their headaches, they had expert physicians interview these patients and found that 80% or more met diagnostic criteria for migraine. So usually when people think they have sinus headaches, in reality, they have migraine. Now, I think the problem that a lot of other people jump to the conclusion is that every sniffle is a migraine in a migraine patient. And I can tell you that just frankly isn't true. In fact, we've done a lot of research looking at a disorder called rhinitis, which is just hay fever. Mm-hmm. And what we found basically was that if a migraine patient had hay fever or rhinitis, is the other term, that they had a much higher frequency of migraine, and they were much more disabling, and the headaches were more severe as well. So if you have these symptoms along with migraine, then you tend to have a worse form of migraine.
Right. I was about to ask if there was an association between the two, and you answered my question, but I'd like to add that I definitely noticed throughout the many years of my progression of chronic migraine, I didn't get many sinus infections, but when I did get them, they were so much worse as my migraines got worse and worse, just because you're so sensitive to the pain. And so it's an interesting phenomenon to me. And I definitely meet a lot of people who I really think that they probably have migraines, and they really believe they have sinus headaches. And so they don't seek treatment for what the pain that they're in. So today, that is all we have for our podcast on what is a migraine, and could I be experiencing more than one type of headache? Please join us again next week for Heads Up, the official weekly podcast of the National Headache Foundation. See you soon.